Commission to order. Commissioner Fishback, would you lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Good morning. First on the agenda, we got Deanna Harbour with the Southwood Department of Health quarterly report. Good morning.
Good morning.
Good morning. How are you today?
I'm good. How are you? Great. Didn't like seeing the snow flying, but I guess it's best that we're up north, huh?
Yep.
Go. Okay, so we're reporting for October through December of 2016. Not a lot over the winter months. We were mainly just giving flu shots. I don't think we gave as many flu shots this year as we have in past years, just because of the change in the cost of what the vaccine was. Influenza activity is on the rise. We've had 160 cases so far this season, with like 68 of them being confirmed last week. 48 hospitalizations and 2 deaths. Family planning in WIC is just kind of business as usual. Overall, family planning has about a caseload of about 600. WIC has about 800. Aberdeen is the latest community to join the Department of Health's Breastfeeding Friendly Business Initiative. We have about 90 communities within the state that have taken the pledge. 90 businesses in Aberdeen, that have taken the pledge, including the Brown County Community Health Center. Department of Health supplies the training and support materials and really encourages businesses to be breastfeeding friendly. So if this is something that you're interested and want to jump on board, the website is there, and you can contact them and they'll come out and give you the information that you need. I did just put some data that came out just here at the end of the year. In 2015, the vital statistics, this is where they take birth certificate data, and we did find that there were only 161 infants born to mothers less than 18 years of age, which is at an all-time low, probably the lowest number ever. In 2005 to 2009, it was 338 births to women under the age of 18. So it's gone down significantly. We've seen the number of mothers that smoke during pregnancy go down. It's about 14% compared to 18.5 in 2009. Women are getting prenatal care in the first trimester that we recommend. We're seeing more infants being breastfed at discharge, and that the number of infants born to single moms is also down. So I think we're doing the work that we're supposed to be doing in the office.
And 14% still sounds high.
It is still high, but
I don't think over 14% of the people in the county smoke, do they?
I don't know.
I see a lot of young, I mean, not that 18 to about 30 smoking.
Yeah. I don't know. It seems, I think, you know, just from working with people every single day, I don't see nearly as many people smoking as I do.
14% seems high to me.
Yep. We don't want to see any moms smoking during pregnancy, so it is something that we work on really hard in the office to get that information out to them. And we do have the Quit line, which now offers some postpartum resources to women, because what we find is a lot of times they'll quit during pregnancy, but the minute they have that baby, they're right back to smoking again. So we do have a new postpartum program that provides them with counseling and some incentives to continue to stay quit.
Can't wait to light up again, huh?
I know, yeah. Well, the baby's kind of probably stressed them out a little bit, huh? 2016, for the health and disease update, I just kind of threw in a few highlights of things that might be familiar to you. E. coli, we had 90 cases. HIV was 49 cases, the most ever reported in 1 year, the highest rate being in Sioux Falls. Gonorrhea is up 57%, with over 1,200 cases, and the highest rate being in the West region, and Hep C up 74% over the past year. We are fully staffed as of today. Amanda Keith is our new full-time RN. She started her duties in November. She will do WIC and immunizations primarily, and she'll help in family planning when I'm gone. And then our new secretary, Jill Molis, just started today. So hopefully, in the next couple of months, we'll be back up and running full speed ahead.
Looks good. Any questions?
Any questions?
How do you guys determine which strain of flu? How is that? Because you hear people saying, well, the one time I got it, I got sick or whatever.
Yeah,
what do you say to that?
You can't get sick from it because it's a killed virus, but a lot of times when you get a vaccine, you might get a little feverish or achy just because you're getting something injected into the muscle, but you can't get influenza from the vaccine. You might have been incubating influenza about the same time that you got the flu shot. How they determine happens the year previously. So they start looking in the southern hemisphere what's circulating. That's how they determine how they're going to go ahead and mix their vaccine for the next year. So it's just an educated guess.
Based on the worst
what,
strain from last year is
yep,
what we do
and
this
then
year.
what in the winter, we're opposite northern and southern hemisphere. So they start looking at the southern hemisphere in their winter season and what is circulating there and what are they going to anticipate is going to come this way. So it's a guess. Sometimes it's a good match and sometimes it's not. And we really won't know until the end of the season how well we did. But this is peak flu season, so this is the time when we see most cases in January, February, March.
How many of those new cases had the shot, you know?
No, that I don't know. But we will,
not telling us?
at the end of the year, we'll have a better idea of how many people were vaccinated, but I don't know. My supervisor just was diagnosed with influenza A, and she did have the flu shot. So, it's still better to get it than not.
And she did not have the flu?
She did.
Oh, she
And
did.
she had influenza A, yeah. So, it's making its way out there, so stay healthy.
Any other questions? Well, thank you so much for
Yes,
taking
you're welcome. I'll see you
the
next
time.
month. Thank you.
Thank you.
Take care. Next on the agenda, we've got the appointment of the new equalization director. So, Mr. Mayor, would you join us at the table?
Morning, Mike.
So after a long search and process, we went through and had a lot of great candidates. We interviewed a number of them and came up with, do you want to go ahead and talk, Gary, here?
Sure. Basically, we want to approve the appointment hiring of Michael Hawk Jr. as Director of Equalization at a salary of $57,784.22 per year, effective February 13th, 2017.
Did you get the information forwarded over to you, the name and the...
Just a name.
Did you have any questions or anything that...
No, I don't know anything more than the name.
Did you get a copy of the resume or anything?
No.
I can certainly get you that right now if you'd like, but if needed.
All right, is there any questions on that?
You've been the assessor in what county?
Rural County.
For almost 4 years?
I'll make a motion to approve.
Motion by Sutton, is there a second?
I'll second it.
Seconded by Hanson. Any other discussion on that appointment? All in favor, say aye.
Aye.
Opposed, nay. Motion carries. Thank you so much for joining us. Appreciate it.
Thanks, Mike. We meet the statutory requirement. You bet.
Yeah.
Got me out of bed for that. Keep everything legal.
All right, that brings us to the end of our regular agenda. Maxine, do you want to work any of us?
Minutes from January 17th.
Move.
Second.
Motion by Feldheim, seconded by Fishbeck. Any questions or changes on the minutes? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Claims, and I just remembered the payroll is on my desk. Let me grab that. I'll skip that for now.
Well, that's what I asked, yeah.
Okay, the HR report is in the packet.
Move it.
Second.
Motion by Fishbeck, seconded by Feldheim. Any questions on the HR report? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Plats, there were 2 for fleece and 1 for rivet.
Move.
Motion by Sutton,
Second.
seconded by Fishbeck. Any questions on the plat? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Sheriff's report.
Move.
Moved by Feldheim,
Second.
seconded by Sutton. Questions on that report? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Abatements.
Move.
Second.
Moved by Feldheim, seconded by Fishbeck. Everybody get the chance to look at those. Any questions? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Appoint the Dakota Curry Museum board members.
3.
Move.
Second.
Motion by Sutton, seconded by Hanson. Questions on those appointments? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
There's a special event liquor license.
Move.
Motion by Feldheim,
Second.
seconded by Sutton. Questions on the
I did
license?
too.
I missed it.
That was the
Randy
golf-
Stanley?
golf
Oh,
cart
that
for the
one.
winter,
Oh,
the golf
okay.
course.
Yep.
The golf course is gonna be providing the license.
Any other questions? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Acknowledge a donation of a Orion rescue sled to the emergency management department, and the value is $3,500.
Move.
Motion by Hanson, seconded by Fishbeck. Any questions on that?
I'm a member of that club. Should I abstain from that?
Probably.
Okay. I'll abstain
Okay.
from voting.
Okay, all in favor,
To be clean.
favor,
Yep.
say aye.
Aye.
Opposed, nay. And one person abstaining.
Yeah. Okay, appoint Josh Halsey to the Citizens Corps.
Move.
Motion by Feldheim. Second. Seconded by Hanson. Any questions on that? All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
And that's all I have.
So,
Except for the claims and payroll, once payroll gets around.
I don't think we have.
I've got it right, I've
No,
got it right
it's
here.
going
Oh,
around.
I'll get you.
I'm just looking at it to see.
Gary, do you have anything for us?
I sent you a note regarding, there was a request made to look at possibly rebidding our benefits next year. I sent you a note, I talked to all the departments and to some extent about if they're seeing any issues or not, which you got a copy of. Did you want to still move forward on doing something or not? It looks like the majority are still doing fine with this one, but it's up to you.
So this is we're completing our second year with Medica. That was
Correct.
is that still July 1st thing?
Yep.
We don't have any idea what their rate increase is gonna be.
And this is their second year, like you said. Maybe we need to give them one more year to let them respond a little bit to the comments made by the people.
But if they would happen to have a 40% rate increase, we probably wanna,
Yeah.
we probably wanna look at something, so that's kinda hinges on, you know, it's kinda hard to make that decision until you know what your rate increase is
When
gonna
are they
be.
gonna go down?
When
now?
are they going to let us know?
It's usually within the next couple months.
Well, then, let's just hold off until
We know what their rate
we
is.
know,
gonna
I
be.
mean, if they have a sizable rate increase, then yeah.
Okay?
What kind of information did you have to provide them in order to get those quotes?
They
Was
do.
that pretty extensive?
Yeah, they're required to get all the employee history of what kind of events have happened. There's a lot of information.
So since it was gathered 2 years ago, is it a lot of work to
You
update it, or?
you have to
can
get it
you
every
do?
year,
Okay.
yeah, because they want to know the most recent events that have occurred with all the employees, so.
But there's only about 3 or 4 companies that will write insurance, Sanford, Rivera, Medica, and Blue Cross Blue Shield are about the only 4.
Well, and then the last time, we had a bunch of companies that did like things.
Self-insurance type thing.
Yeah, self-insurance and things related to exercise programs, benefits, those kind of things too, so.
I think we wait and see what the rate increase is.
I think we
Wait on that?
have to wait, yeah.
Sounds good.
Okay.
I sent you also the burial cost plan for Minnehaha County, and I don't know if you wanted to talk some more about that today or not.
Did we determine that it didn't have to be the reorg meeting?
Yeah, I took a look at the statute, and the statute does require you to address it at your organizational meeting each year, but it doesn't say you can only do it then. That would make some sense if somebody, a provider drops out and you don't have any provider, you gotta do something, and that may mean you have to make some changes. So it says that you have to do it, it shall do it, but it doesn't say you shall only do it, and so I think you're free as needed during the year to make some changes to that. I would suggest probably, the intent is to let the providers know what the rate structure is gonna be so they can participate or not. So I would suggest maybe if you were to make changes, you wouldn't reduce it because they've already made plans. But if you want to increase it or do something else with it, subject to their, being on board, I don't think there's any statutory restriction on that.
Okay, thank you.
I'd just like to be able to set the reimbursement rate, you know, sooner than later, because we're already a full month into the year. That way they know, because they'll be having some funerals come up, so.
Sure.
I agree.
If we, and I was just looking at numbers, last year, it looks like we had about 14,500 in burial expense. There was 11, I believe there was 4 that were actual burials, and there was 7 that were cremations. If you did a 35% increase, it would increase the welfare budget about $5,100. That would then put the funeral at about $2,300 for a full. That would include the $695 for the setup. And it would also then move the cremation for a no service of $1,350, and a cremation full service would be $1,600. And that would be a 35% straight across the board of what they were getting.
And refresh me what Minnehaha is doing again.
Yeah, that was,
2,000.
2,000 straight across.
Yep, for either.
And that seems simpler and easier to work with and probably,
I kinda like that too, that was
yeah,
not necessarily the price, but the,
treat them all.
treat them all the
Know
same.
exactly what it is, yep.
Yeah.
Same, regardless of which they choose, it's the same
Right.
price.
And that seems like that would cover the cremation.
Just what would yours been, say your numbers again?
Well, we
This
went
is
with...
lower on cremation there.
Well, cremation would be
Higher.
$1,600 and $1,350, and a full funeral would be like $2,300. And
So the two,
it'd be substantially less than the straight 2,000.
Yeah,
But,
see that.
But you don't have that many, and they got family
Yeah.
participation in there a little bit.
Yeah, I like the Minnehaha
I do
plan, just
too.
to the flat fee.
Plan would
for
be-
And they
either.
did a lot of
We could
research
maybe
on
do a little
that.
less,
Yeah.
do the flat fee, but
like
maybe something,
like 1,800.
Well, we're coming down to 2 instead of 23, and we're coming up about 3 on the cremation, so they kind of average each other out.
And they did more
Yeah, but-
cremations than they did
Yeah,
burials.
cremation would go from $1,200 to $2,000, it would
Yeah.
go up $800, which would be a substantial increase on that part of it.
But I think overall, I think we can level it and give them what they think is necessary for their cost.
Because it's been, I can't remember the last year they were reviewed and increased, but it's been quite a few
Yeah.
years. I don't have that sheet in front of me, but
Yeah, I don't either.
So then the $2,000...
Well, I don't know if we need to go to 2,000, though, Doug. We can-
Well, the other thing is you get that $695 that you're paying for opening and closing and the fees. Is that gonna be on and above the 2,000?
I would say that would be included in that.
I would think it'd be included.
2,000 is all they get.
Oh.
So then,
over.
if you're gonna take that off, they're really not getting an increase for a full-time burial. Because right now, they're at 12 plus the 695, so they're at 1,805. They'd get about a $195 increase on a full burial.
But those numbers are
But they would gain on the other one.
considerably fewer.
But yeah, they'll gain on the other one.
Yeah.
And it gives them the opportunity, and I know in reading that, it gives them the opportunity to recoup some of the costs from the family, where they don't have that option and flexibility now.
And on a cremation, you wouldn't be opening the site. You wouldn't be opening a grave.
So then, you'd almost have to go to get them any kind of increase, you'd almost have to go to a minimum of 2,000 for full service minus the 695. That would be, they wouldn't be getting much of a bump there, but they would get their biggest bump on a cremation.
Yep.
Right.
And I
There were
think-
more of those than traditional.
If they're getting the
anyways.
same as Minnehaha County, they shouldn't have too big a gripe, I would
No,
think.
they shouldn't.
and you're sure that's included in theirs?
Yeah.
The way I've read it,
In there, is
the
that
way
how
I
you
read
read
it.
it?
but-
That's the way I read it too, yeah.
Okay, would there be, anybody wanna add?
No, just a note, you don't have it on the agenda for today.
Right.
You may
Okay.
want to,
Defer it one more week?
you may want to put it on the agenda for next week and do final action then.
Okay.
That sounds good.
And it'll be in resolution form to
Maybe you want
correspond with what we have been
Okay.
doing.
Maybe we
Maybe
should
Gary
visit
could
with
check
them.
with them again to make sure there's no other,
For opening and closing the grave,
Yeah.
they should find out, make sure
Well,
that
the
that is...
cremation, there should be an opening and
That was
closing.
the full service.
Yeah.
Right.
Could
Do
you
it.
add that to next week's agenda and we'll...
Sure.
Okay.
Now, do you want Clifton's comments here?
Yeah, we could, just in case there's questions that come up. That tends to happen, so.
If he wishes, I mean, he might have
Yeah, they might
already
come in.
gave that to Gary.
They'll probably come in.
Yeah. Okay, any other questions on that? What else you got for us, Gary?
That's it.
Okay.
You wanna go back to claims?
Yeah,
payable?
let's do that. Everybody's seen the claims and payroll that went around?
Have we got a motion on it yet, or?
No,
No.
we haven't.
I'd move it.
Motion by Fishback,
Second.
seconded by Sutton. Any questions on those? All in favor, say aye.
Aye.
Opposed, nay. Motion carries. Did anybody else have anything? Looking through my list. So we are gonna, that committee on the BC Connects meeting after commission, do we need to set up and meet on? Oh, reviews. Did you need something?
Yep, I still need, last time I only had one response, so.
Sorry.
We still need to, do
That's
three
right,
of them
right?
right now, so if anybody available like Thursday afternoon or next Tuesday?
I could do next Tuesday.
I could do next Tuesday.
Next Tuesday afternoon at 2:30 and 3.
Yeah, see if there's-
That'll work
Okay.
for me.
You?
Perfect.
2:30 and 3.
I have Tuesday mornings free, so if you ever need me
How
in
do
the
you think
morning.
they could go to after commission?
We can try, we can shoot for that.
Try for earlier is better for me.
Yep,
So maybe earlier, okay, I'll wait and put it
we'll
in.
try, and yeah, I'll send it out, but yeah, we'll try and shoot
First
for
week of
right
February gets a
after.
little nuts. All right, anything else from the commissioners?
We're gonna do our training.
Yeah. Anything from the folks in attendance today? All right, do we need, Paul's gonna come up and train us how to use the surfaces. Do we adjourn or do we recess if we're all gonna be here to do that?
That could be a laugh.
I think to just avoid any question, maybe just recess
Okay.
and be officially in session while you're pushing the buttons and doing whatever, so.
Okay, sounds good. Well, then we don't need a motion, we'll just be in recess. Is that right? Okay, thank you.
What do you call it, new laptops?
No, he calls them surfaces.
Surface.
Surface
It's-
clothes.
It's like an iPad is an iPad, a surface is a surface.
Okay.
Oh, I might just
So we're gonna
slap out
plug
and get
those in.
you into
Tablet.
And when he comes up here,
I
I'll
was
ask
thinking
him
we
about
should
that
maybe-
copier.
Go down through there.
So,
Are they coming?
is Sheila coming up
They
here
only have
slower
to
than
be
the other
charged.
copier?
He's coming up here,
No,
isn't he?
Sheila had mentioned that hers
What,
is
tell him
slow.
we're free?
Oh, they're very slow.
Both of them. So it's not like a setting thing, it's just the copier in
It's
general?
just the copier in general, yeah. Here's your,
No.
payroll.
What's school?
The new copiers.